Have you ever wondered why one medication seems to help with so many different mental health conditions? Maybe your mental health practitioner mentioned Abilify, or maybe you've been prescribed it already. And now you're staring at the bottle thinking, is this the right choice for me? Today we're diving into Abilify, also known by its generic name Aripiprazole. This is a medication I turn to quite often in my practice, not because I take antipsychotics lightly, I definitely don't, but because Abilify offers something rare in psychiatry, versatility with a relatively low side effect burden, at least compared to other medications in its class. Let's walk through the good, the bad, and when I personally reach for it in the clinic. What it's supposed to do. Abilify belongs to a class of medications called atypical antipsychotic, but don't let that label fool you. It's not just for schizophrenia or bipolar disorder. What makes Abilify unique is how it works. Unlike most medications in its class that simply block dopamine, Abilify acts more like a thermostat for your brain chemicals. It partially stimulates dopamine and serotonin receptors, balancing things out rather than just shutting them down completely. This Goldilocks effects is why it's FDA approved for schizophrenia, bipolar disorder, including bipolar mania and bipolar maintenance, depression as an add-on, autism-related irritability, Tourette's, acute agitation for anger and things like that in its injectable form. Off-label, it's used for even a wider range of conditions: anxiety, OCD, premenstrual dysphoric disorder, disruptive mood dysregulation disorder, even as needed for anxiety in certain situations. Bottom line, it's one of the more flexible medication options we have. Side effects and red flags to think about. Now, no medication is perfect, and Abilify is definitely no exception. Let's break down the side effects into 4 key buckets. Common but usually mild, in other words, occurring in over 0.5 to 1% of patients. These tend to be more annoying than dangerous. Restlessness or inattention, what we call akathisia, that can occur in up to 20% of folks who feel just too revved up and jittery, and sometimes that is extreme enough to where they want to get off of it. This next one is interesting. It can cause sleepiness and sedation, but it can also cause restlessness, increased energy, and insomnia. It's unique to each person. Other side effects to watch for in that nagging category are headache, constipation, blurred vision, mild tremor, mild weight gain, and usually it occurs in less patients and at less severity than other medications in its class. Also watch for GI side effects like nausea and vomiting. Metabolic and hormonal risks. Here is where Abilify really shines compared to other antipsychotics. It has a very, very low risk of causing problems because it has a low, if not zero, chance of increasing prolactin levels. This is great because other medications in the class that do cause increases in prolactin levels will lead to milk letdown, actual lactation, as well as hormonal irregularities leading to menstrual changes in women, even some boys who develop breasts because of that prolactin elevation. Again, Abilify does not do that. In fact, it tends to be used to treat that when other medications in that class cause that. Now, Abilify is less likely to cause significant weight gain or what's called metabolic syndrome, type 2 diabetes, but this varies. Some people still can gain significant weight, and labs need to be followed to make sure their insulin sensitivity and their cholesterol stays within the normal limits. Movement side effects are extremely important in this class. All antipsychotics can cause what we call extrapyramidal symptoms. This includes muscle stiffening, shaking, something called tardive dyskinesia in the long run. That's a very rare but serious risk with long-term use of this class of medications. That involves involuntary, repetitive movements, often of the face and limbs, sometimes the mouth. Abilify's risk for this is much lower than average, but it is not zero. Serious red flags to watch out for. While rare, call your practitioner right away if you notice any of the following: sudden stiffening of your neck, your ability to swallow, or any other muscles in your body. Sudden changes or increased agitation, signs of high blood sugar or diabetes, suicidal thoughts, especially in patients under the age of 25. Also important, never stop Abilify abruptly without a plan. Tapering under medical supervision is important here. Okay, my take on this. Let me be clear. I don't hand out any atypical antipsychotic lightly, but Abilify is often the one I'll reach for first when we're considering this class of medication in certain cases. Why? Because it tends to play nice with the body. For about 8 out of 10 of my patients, side effects are relatively minimal. I use it across many diagnoses: autism with irritability, severe irritability outside of autism, such as in DMDD or in intermittent explosive disorder. I even sometimes use it as a last resort add-on for treatment-resistant OCD. It sometimes makes a major difference. It's slightly less likely to cause weight gain than most other medications in its class, and much less likely to induce hormonal problems. It rarely sedates too much as well, and it's flexible. I can give it in the morning, I can give it in the evening, or I can even split doses depending on the person's symptoms that we're trying to treat. That said, it's not perfect. About 20% or more of patients report feeling too restless or revved up on it. And for folks with severe bipolar disorder, severe anger, or certain kinds of psychosis, it sometimes doesn't pack enough punch. For some patients, it can lead to big increases in weight, which then of course can increase the risk of insulin sensitivity problems or type 2 diabetes. For dosing, I've prescribed anywhere from 0.5 milligrams, you can do that in a liquid form, up to as high as 15 milligrams. But my usual sweet spot is anywhere from 5 to 7.5 milligrams total in a day. If we decide to try Abilify, we would check in often, adjust as needed, and make sure it's actually helping you feel more like yourself. I always start extremely low and go up slowly. So if you or a loved one are considering Abilify, know that you're not alone and you have options. I'm providing a link to a great resource that discusses all side effects as well as dosing options. It'll look at the pros, cons, and how to even manage some of those side effects. You can find that in my Mind Vault at drdaviddanish.com, and I'll be sure to put the link in the description. And if you found this helpful, please don't forget to like it, subscribe, and send it to someone who might find it helpful. We're here to make these decisions a little easier together. Take care, and I'll see you in the next video.